Have you ever wondered why some people seem to have such extreme personalities? Why your friend's mood swings are so intense, or why your coworker always needs to be the center of attention? These aren't just quirks or bad habits, they might be signs of personality disorders. These complex mental health conditions affect millions of people worldwide, yet they're often misunderstood and stigmatized. Today, we're diving deep into the world of personality disorders to uncover what they really are, why they matter, and how we can better understand and support those affected by them. Welcome to the Brain Talk Sessions YouTube channel. Your journey to a healthier mind starts here, where we share psychology explained for everyday life. Personality disorders are more than just character flaws or mood swings. They're deeply ingrained patterns of thinking, feeling, and behaving that significantly impact a person's life and relationships. Understanding these disorders is crucial not just for mental health professionals, but for all of us. They affect our families, our workplaces, and our communities. Unfortunately, there are many misconceptions about personality disorders in society. Some people dismiss them as simply bad behavior or believe they can't be treated. Others use terms like narcissist or borderline casually, without understanding the real clinical meaning. Today, we're going to clear up these myths and provide you with accurate, compassionate information. So, what exactly is a personality disorder? According to mental health professionals and the DSM-5, that's the Diagnostic and Statistical Manual of Mental Disorders, a personality disorder is a persistent pattern of inner experience and behavior that deviates significantly from cultural norms. This pattern is inflexible, pervasive across many situations, and leads to distress or impairment in important areas of functioning. It's important to distinguish between personality traits and personality disorders. We all have traits that make us unique. Some people are more outgoing, others more reserved. These are normal variations. Personality disorders, however, are extreme and problematic versions of these traits that interfere with daily life and relationships. Psychologists categorize personality disorders into three main clusters. Let's break them down. Cluster A includes the odd or eccentric disorders. There's paranoid personality disorder, characterized by extreme distrust and suspicion of others. Schizoid personality disorder involves emotional detachment and limited interest in relationships. Schizotypal personality disorder is marked by odd beliefs, eccentric behavior, and social anxiety. Cluster B contains the dramatic or emotional disorders. Borderline personality disorder involves intense emotions, fear of abandonment, and unstable relationships. Narcissistic personality disorder is characterized by an inflated sense of self-importance and a constant need for admiration. Histrionic personality disorder involves attention-seeking and highly dramatic behavior. Lastly, antisocial personality disorder is marked by a disregard for rules, lack of empathy, and manipulative behaviors. Cluster C includes the anxious or fearful disorders. Avoidant personality disorder involves extreme shyness and fear of rejection. Dependent personality disorder is characterized by an excessive reliance on others for decision-making. Obsessive-compulsive personality disorder, which is different from OCD, involves perfectionism, control, and rigid thinking. Now that we've outlined the types, let's discuss some common signs and symptoms of personality disorders. One major red flag is difficulty in relationships. People with personality disorders often struggle to maintain friendships, romantic partnerships, or work connections. They might have extreme emotional reactions, getting overly angry, sad, or anxious in situations where others wouldn't. Another sign is a distorted self-image. This could mean an inflated sense of self-worth, as in narcissistic personality disorder, or an extremely low self-esteem, as often seen in avoidant personality disorder. Problems at work or school are also common, with individuals struggling to adapt to rules, work in teams, or respect authority figures. But what causes personality disorders? Like many mental health conditions, there's no single answer. Instead, it's usually a combination of factors. Genetics play a role. These disorders often run in families. Childhood experiences, especially trauma or neglect, can strongly contribute to the development of personality disorders. Environmental and social influences, including culture, peer pressure, and upbringing, shape our personalities and can sometimes lead to disorders. Brain function and chemistry also play a part. Imbalances in neurotransmitters or structural differences in certain brain regions have been linked to various personality disorders. It's a complex interplay of nature and nurture that leads to these conditions. Diagnosing personality disorders is a challenging process that requires expertise and careful assessment. Mental health professionals use clinical interviews, psychological tests, and patient history to make a diagnosis. It's not something that can be determined through a quick online quiz or casual observation. One major challenge in diagnosis is the stigma surrounding personality disorders. In many cultures, the symptoms are misinterpreted as moral failings rather than mental health issues. This stigma often prevents people from seeking help, leading to underdiagnosis and unnecessary suffering. The good news is that treatment for personality disorders is available and can be very effective. Psychotherapy is the primary treatment approach. Cognitive behavioral therapy, CBT, helps patients change harmful thought patterns and behaviors. Dialectical behavior therapy, DBT, is especially effective for borderline personality disorder, focusing on emotional regulation and coping skills. While there's no cure for personality disorders, medication can help manage specific symptoms like depression or anxiety that often co-occur with these conditions. Lifestyle support is also crucial. Mindfulness practices, establishing healthy routines, regular exercise, and participating in peer support groups can all significantly improve quality of life for individuals with personality disorders. Breaking the stigma around personality disorders is crucial. Instead of labeling people as toxic or crazy, we need to see them as individuals living with a challenging condition. By raising awareness and fostering understanding, we can reduce discrimination, encourage people to seek treatment, and create healthier, more compassionate communities. To recap, we've covered the definition of personality disorders, the different types and clusters, common signs and symptoms, potential causes, the challenges of diagnosis, and available treatment options. Remember, personality disorders are complex mental health conditions that significantly impact people's lives, but with proper understanding and support, those affected can lead fulfilling lives. If you or someone you know struggles with symptoms of a personality disorder, remember, help is available, and you are not alone. Reach out to a mental health professional for proper assessment and support. We hope this video has helped you better understand personality disorders and their impact. If you found this information valuable, please subscribe to our channel for more psychology explained for everyday life. Share your thoughts in the comments below, and let's continue building mental health awareness together. Your mind matters, and understanding it better is the first step towards a healthier, happier life. Until next time, take care of your mental health, and we'll see you in the next Brain Talk session.